if anybody's a provider, could you maybe raise your hands? So if you're not, probably parents. Okay, just interested people. Any educators? Any insurers? So I am delighted to be here. The title of our talk is Got Insurance because a year ago we didn't have insurance for autism treatment, and it's June 16th. It was looking a little bit bleak about whether we would get a law passed, and I'm going to embarrass her, but one of the people here is Kate Supple, who was on the Advocates for Autism Insurance Committee and was instrumental in really communicating in only the way that she can.
Back at you, Amy worked hard on this full-time for 2 years as a volunteer through AFAM, leading the effort. So right back at you.
Thank you. So I was very pleased that we have a law that we can talk about, and I'm going to talk about a new resource to help people, which is the Autism Insurance Resource Center, which is part of UMass Medical School at the Schreiber Center. So I'm going to kind of go quickly through some of this, but happy to ask and answer lots of questions because you will have them. You know, the only thing I'd say is we got a very strong law passed. It's a very important law passed, but there's a big curve from getting a law passed to actually getting reimbursement for your services seamlessly. And we're not there yet, but we're going to get there. And that's part of what we're doing here, and it's ongoing work that is going to be ongoing for some time. The reason we say Got Insurance is because our sort of marketing campaign, and Kate will tell you I'm not a marketeer, was, and our marketing budget, which was zero. We got little stickers printed up like the Got Milk font, and we had Got Insurance, not if you had autism. And if you came near me in any activity last year, you were given these and everybody had to wear them. But it actually made a powerful statement, and we got insurance. The new law is called Arica, which stands for an act relative to insurance coverage for autism. So I will go through how we passed the legislation, why the Autism Insurance Resource Center was created, then what you probably really came to here, which is what Arica does and doesn't do, who's covered, who's not, what steps you might have to go through, where we are in the implementation phase. I really thought when we were working on the passage that I was kind of running a marathon, which we were, and it was hard, but I found out about a week later that through my partners at Autism Speaks, who were a phenomenal resource in helping us. This is really a triathlon, and it's really 3 legs. The first is passing the bill. The second is the implementation phase that we're still in. And the third phase, which we haven't gotten to yet, but we're kind of rapidly approaching, is probably going to be enforcement. And then I'll talk about what the next steps are. So I'll talk a little bit about how Arica became a law. And I love to say it was fearlessness and facts. We had very strong leadership in the legislature on the House side with Representative Barbara Italian, who herself is the parent of a child on the autism spectrum and gets it. She is no longer a legislator, but she has been instrumental for about 8 years in getting a number of pieces of autism legislation passed that many of us have benefited from, and is still a kind of a force there and really a resource. The second huge proponent was Senator Fred Berry, who is the Senate Majority Leader, and I didn't actually know this before I worked on this, but he was actually the architect of the early intervention laws. And as a parent myself, you know, I didn't really think about when I was dealing with all of the emotion, confusion, and overwhelming things surrounding my daughter getting diagnosed, that early intervention just kind of showed up at my doorstep with services. Well, it took laws to get that done, and Senator Berry did that decades ago and continues to be a really strong voice for disabilities. Then we had Autism Speaks, which, as I said, is working on a national level with many states to help in their efforts. And it's really like having the resources of a phenomenal strategy, marketing, PR, lobbying resource at your fingertips. And it's really what you need to get a law like this passed because it's complex. And then the Advocates for Autism in Massachusetts Insurance Committee, which I chaired and had about 10 to 15 really phenomenal people, all volunteers, who brought huge resources. Most of us, I think probably all of us, were parents, and got this law passed. So I love this quote from Dr. Robert Jarvik, which I don't think is used enough. Everyone uses a Margaret Mead quote about what a small group of determined people can do, but I think really we had some visionaries, and we were just fearless. I would attribute that to our legislators, and then the people on my committee and myself especially were frankly clueless, and I think the two was powerful. The other thing that really got this passed were facts. The state, as part of any mandate, has to do a mandated benefits analysis. It's an excruciating report. It took about 6 months to produce, and I was pretty cynical during the process about why we had to go through this. I thought it was frankly just another stalling technique. But at the end of the day, that report was a huge resource in that process because it gave some third-party validation to what we're trying to say. So none of this will surprise probably people in this room who are, if your parents, kind of living with autism, but guess what? They concluded that autism treatments were medically necessary and had strong evidence to support efficacy. I sort of feel like I could have said that. Kate said that. She said that very eloquently. But you know, we had a big insurance industry that was saying and is still saying that these are experimental treatments. There's no evidence, even though there's decades of research and other things. So this really laid out the facts, showed where the research was, and it was important to substantiate that for all the challenges that came to us. The other really, really important thing was what the cost was going to be, because it always seems to always boil down to money. And it came down to, insurance premiums are measured in a per member per month basis. And don't ask me why, because I was a banker in my former career, and it's crazy, but it's $1.84 per member per month, and I felt like at times I was like running a Save the Children campaign. I'd be like, for a cup of coffee, you know, kids can have access to autism treatment. What's so hard to figure out? But it was. I like to think of things in percentages because we were reading about double-digit rate increases and all these pressures. It's a fraction of a percent. And then the final thing that I think was said in this report that really got it done was, without insurance at the table doing their part, not covering all of autism, but covering the medically necessary treatment that so many of our families need, the state is the payer of only resort, of last resort, and the reality is most people go without, get haphazard or fragmented care, and fall between the cracks, and we're paying for that on so many levels through our lifetimes. So I won't go through the details of how the bill got passed, but I can tell you it will make a phenomenal movie when it comes out, so please go see it. And, but it did get passed in glory. It passed unanimously in the House and the Senate. That doesn't mean it was easy or pretty, but it passed. And then the governor signed the bill in Fenway Park at a signing ceremony, which is not where they usually sign bills, but I think it speaks to how important this was both for our community and for the greater community. And because he was signing the bill at Fenway Park, and because it was 3 days after the casino bill had passed, we got a ton of media attention. We were really excited. So in that picture is the governor smiling, and the Speaker of the House. The Senate President was there. She's not in the picture. Representative Italian is behind him. Senator Berry is seated to the right. And the guy in between with his head chopped off is was actually a really important figure. His representative named Garrett Bradley from the South Shore, and he really brought the opposition in at the 11th hour. And I wouldn't say we had to broker deals because we got the bill passed, but he really worked to get this through and get it through strongly, and we're very grateful to him for that. What I learned in this process is bills rarely get turned down. You might read about the ones in the newspaper, but they get vetoed and they get voted down. The game with getting a bill passed is just getting it to a vote. I mean, there's thousands of bills passed every year, and there's a whole process. They go to committees, more committees, and here, there, and everywhere. So if someone doesn't want a bill passed, they don't get it voted down. They just make sure it never moves to the next step. And that's why some of these people who got this thing moved at critical times was important. That's the polite version. Kate will tell you all of the discussions we had, but it wasn't. I had a video to show the signing, but it doesn't work. So the thing I realized was before the ink was dry on the legislation. The questions that started coming across the emails and the wires about how we were going to actually access this and how this was going to work for insurers, for consumers, for providers, candidly, because many providers of autism treatment have never worked with insurance and billed insurance before, were really pretty overwhelming. And I actually had a prior research fellowship for 1 year at the Shriver Center at UMass Medical School, and they approached me about setting up an Autism Insurance Resource Center, which is part of something at the Shriver Center called New England Index, which is a phenomenal database of resources for people with disabilities on all levels, and it's got everything from providers to funding sources to summer camps, and it's a perfect place to, basically establish a home for the Autism Insurance Initiative that can provide this information in a really cohesive and powerful way, and it gives us an infrastructure to really continue the next phase of our work. And they asked me to direct that center, which I feel honored to do. So the Resource Center really has 5 major components, and there's a flyer. I would encourage you to take that to visit our website. But first thing we have is an information and referral line by phone, email. No question is too minute or too major. We try to deal with all of them. And there's actually a person there during business, people there during business hours who can answer the phone and help you and direct you. Chances are, if it's related to autism insurance and it's more than a request for some specific information, you'll probably get to me at the end, but that's expanding. Everybody there is getting up to speed. The second thing is, on our website we had access to all the documents, so if you want a copy of the legislation, you can find it there. If you want a copy of this fact sheet, frequently asked questions, which are frequently asked and frequently updated, that's also available there. There's bulletins that are coming out from the Division of Insurance as we encounter issues that need to be addressed. All of those things are up there. I'm also going to speak a little bit about plans that are not covered by this law, and there are many people who have plans in Massachusetts that are not covered by this law. And we have support for those too. So even if don't have a policy that's covered by Arica, that doesn't mean if you have autism, you need insurance, you shouldn't call us to try to help. And then we are about to roll out webinars on the insurance laws and related specific topics. When I say about to, I did the first trial this afternoon. It was kind of like connecting the internet tonight, but after a few minutes, we got it all working. So more to come, but for people who can't get out and I can't make this, these are going to be available at various times, live, where instead of sitting here, you could be sitting at a computer looking at it and listening to me blab on, but you can ask questions, you can call, and they're also going to be archived so you can tune in. And I would invite you to tell people about that and spread the word. And then we're having trainings like this one, and those are going to continue, and focus groups to examine specific issues. Are there any questions? Everyone's really quiet. Yes?
When you say training, what kind of trainings are going to be available?
Right now we have specific general trainings about the law, like the parent training. We have other trainings that we give to providers who have questions about, like doctors have questions about how do they write reports to get insurance coverage. We're dealing a lot with issues around education and medical and where those lines are, so it's kind of whatever the need is. So I'm going to talk now really about probably what you came to hear, which is, am I covered? How am I covered? What if I'm not covered? And a lot of this is related to this FAQ sheet, so there's more details on that, and I advise you to refer to that. What I've learned, and I have to preface this by saying I know a lot about the autism insurance law. I knew like squat about medical insurance before this. I didn't quite, and probably still don't really understand what my own policy covers. So I can tell you what I know, but I probably can't, with any accuracy, answer a specific question about your policy, and if I do, it's worth the price of what you paid to come here tonight. So I have to give that disclaimer. But we do try to help it, and we are able to help with it. And for everything that would seem straightforward in insurance law and insurance, there's always a but. So the first one is, like, when does Arica go into effect? And that should be a pretty straightforward thing, and the legislation says January 1st. But what happens is that people's policies renew all throughout the year. So depending on when your policy renews, Arica may not have been in effect for you January 1st. There are many policies that renew on July 1st. So for those people, Arica goes into effect July 1st. And we're halfway through the year, so it's becoming a little bit less of an issue, but it's whenever throughout the year your policy renews.
So anything that took place, say your policy renewal is July 1st, so any services you had for your child between January and July 1st, you cannot get reimbursed for? Or can you try it?
There's always a but. But you couldn't get reimbursed under Arica. And it only affects certain types of policies, which was, candidly just about every type of policy we could get our hands on, but there are some that are frankly out of the reach of the state mandated benefits and legislature. So these are the different classes of insurance. And private insurance is if, an employer goes and buys a policy from an insurance company to cover their employees. State employees are covered under something called the GIC, and some municipalities actually have coverage under the GIC, so they are included. And then there's hospital service plans, HMOs, the major classes. So who isn't covered? And this is, probably more than, I'd say, half the people in the state and half the people in this room. Two big groups. One are employees who work for really large companies, or even mid-sized companies, and many companies that have operations in numbers of states. Many of those companies might have a policy through, say, a Blue Cross. And you have your card, and it looks like you have insurance through Blue Cross. But when you go to try to get services under Arica, you're told that your company has not opted into the coverage. And you're like, well, what the heck is this? It's a law. But the fact is that those companies pay into a pool, and the benefits are paid from that pool, and they're governed by a federal law that is called Arica, which stands for the Employee Retirement Income and Security Act. The only reason you need to know that is it's a lingo that people will say, oh, you have an Arica plan, you're not covered. But it means that you have a self-funded plan. It means that those plans are federally regulated, so any state law that we passed is not going to apply to them. And as I said, it includes many of the state's largest employers. It's probably 50% of employees in the state, not companies, but employees work for companies that have those plans. And you can't find it out from looking at your insurance card. The only way you can find out is either checking with your HR department or calling the insurer. And then, but that's the bad news. The good news is some employers, as a matter of course, just say, if it's a law and we're in that state and we're doing business, we're going to follow it. Some, with the right information, will weigh it. Some decided to cover it at the beginning of January. Some, after discussions this year, are covering it, and many are really considering it for next year and perhaps beyond. They really want to see how it runs. I did have actually someone from an insurance company who really wasn't too happy with me. We were talking, and she said to me, she expects within 2 years all of the self-funded companies will be covering it, which I thought was great to hear. But we have a lot of outreach efforts underway for both employees and employers, because there are two ways that you can get a company to cover it. If you're an employee, sometimes just making a direct appeal and saying, this is really important to me and my family, this is the law, will you consider covering it, is very powerful. And we have a template letter that we've drafted that you can kind of customize and download and explain why you need this. The only good news, I think, in my mind about the prevalence rate of autism being so high is chances are whoever you're sending that to is no more than 1 or 2 degrees separated from this themselves. And then we are reaching out to companies directly, because I learned this the hard way. My husband works for a self-funded company, which I didn't know when we were working on Arica, but it's a large tech company that generally provides generous benefits, and really didn't think it was going to be a big issue for Arica, and he went to them in November and said, there's this new law, are you guys going to cover it? He didn't tell them that he was Mr. Amy Weinstock, and he was told he couldn't come home without the coverage, so he was doing the soft sell. But they, as most companies said then, now that more know, but they said, well, we don't really know about this, we'll look into it. They looked into it. They called their insurer, which was one of the big three, who said, oh, you know, that new law, you don't want to go there. You already cover a lot of speech and OT, and they have a generous speech and OT benefit, and this law covers things like ABA, and we're not going to have a network of providers, and this is really a splinter treatment, and you know, just keep it as it is. So he got a very nice letter saying, we intend to provide comprehensive coverage, but based on what we heard, they weren't as candid about what he told them. We're not going to change our policies at this time. So of course, he was in a bit of trouble with me. And he went back to them and said, you know, saying you're covering autism insurance, but not covering ABA is kind of like saying you're covering cancer without covering chemo. You might want to reconsider this. And they were like, well, the poor person he was speaking to was like, oh, you're going to talk to somebody else. But when he talked to one of the decision makers, they said, God, we had no idea. So we sent them information about why this was important. And it was really relatively quick and relatively cordial. And they understood it, and they said they would cover it. What it showed me is that we can't wait for employers to talk to the insurers about whether they should cover this or not. We need to get to them directly. So part of the work that we're doing is we've developed a survey, and we've developed what we think is a pretty inclusive list of all the self-insured employers. And we're going to be going out to them directly to say, do you know about this law? Have you considered coverage? Are you going to cover it? I'm not expecting to be able to stand here in 6 months and go, X% said they are and X% said they're considering. What I'm hoping is that some of those employers will say, gee, I'm going to call the resource center and find out what this is all about. But if any of you do work for self-insured companies and you want to ask and advocate for this benefit, contact us and we're happy to help you. The other big group that is not subject to Arica is people on Mass Health. And obviously Common Health as a secondary to Mass Health. And it's, again, not that we did not want to include them in this law, given the budget environment. This law would not have moved off the dime if it had a direct cost impact to Mass Health. However, there are many ways that Mass Health can be very helpful for people who have that as either their primary or their secondary coverage. For people who have Common Health as a secondary coverage, like Carolyn's family, they will pick up, or I say may because everything is still a little fuzzy, but in theory, they should be picking up the copays and deductibles that you're paying for treatments. And if you're accessing intensive treatments through this, those are going to add up and be sizable. The other really important thing is for people who have Mass Health as their primary insurance, there is something called the Premium Assistance Program, and I've left a flyer here about that, where through Mass Health, they will subsidize the premiums to purchase a private insurance policy, and that private insurance policy is subject to the law. And I have talked to some DDS caseworkers, and there's all different kinds of policies and all different kinds of prices, but it is sometimes possible to get a policy with premium assistance where premium assistance will actually cover the entire cost of that premium, and it gets you access to Arica. There's a few things to know. One of the ways to do that is through a program called Commonwealth Choice, which helps people who don't have employer-sponsored insurance to purchase it. And that has a window, like an enrollment window of July 1st to August 15th. So if you think this is going to be of interest to you or your family, you want to kind of get on this really soon. Yes?
Quick question. If you join Mass Health in addition to your private insurance company, as far as the deductibles, do they usually reimburse you for those? Or if they cover deductibles and co-payments, how does that usually work? Do they get billed directly, or you just submit them to Mass Health to get reimbursed?
It's not completely clear yet. I know there are some providers who are Mass Health providers who are submitting those directly to Mass Health. I know some other providers and families are running into issues about how to do it, so we're still kind of working on those mechanics. So if you are in that situation, I would talk to your providers and I would talk to Mass Health.
But on the issue of having Mass Health as a supplement to getting them to pay the co-pays for like medications and doctor's visits, the doctor just bills Mass Health directly, or or like Walgreens or whatever, you get a separate, insurance card from Mass Health for your child, along with like their primary insurance. You give them a copy of both of those, and there's no paperwork. I've never had to fill out anything to have them cover
What about for
both.
like speech and OT?
That, I think it depends on if the provider takes Mass Health.
Oh,
That's what the issue is. The other programs that can assist people are, there's the Massachusetts Children's Autism Medicaid waiver for children under 9. That is a very limited program, although I actually heard today there may be some more slots opening up. So you want to kind of follow that if that is something that might apply to your family that you would be interested in. And then there's another program in Mass Health called the Early Prevention Screening, Diagnosis, and Treatment Program, EPSDT. And under that program, they are required, as a result of some litigation, to cover many treatments, including in-home behavioral health treatments for people with autism. I have heard people from Mass Health say we cover in-home behavioral health treatments under EPSDT for people on Mass Health with autism. We use trained behaviorists, but it's not ABA. So I don't know if it's the same kind of treatments or what it exactly is, or if there's a lot of lingo going on, but it's an avenue to pursue if you don't really have an alternate route. And I know some families who have had success with it. So for the $64,000 question, what treatments exactly are covered? And you might want to refer to the back of the fact sheet right here, because there are these 5 bullets and categories of treatments that are covered, and they are, the language that is in here is the actual language from the legislation, and some of it's very specific and some of it is intentionally vague, and I'll explain why that is. And there's a lot of discussion about these still. The basic premise is that Arica should cover medical treatment that is determined to be medically necessary by your doctor, physician, or psychologist. What I've learned in this journey is that medical necessity is a term unto itself. There are inches of Massachusetts law that deal with medical necessity, and not only is the doctor sort of primary determiner of what is medically necessary for your child, insurers review that and they make their own determinations. It's not completely different from an IEP process where a professional might make recommendations about what your child needs and then a school reviews those and you often have a discussion. So, and I think in the big scheme of things it's probably a rational system for checks and balances, but for all of us who are kind of getting up to speed on autism insurance, and especially for insurers who have never covered it before, it can possibly lead to some interesting discussions and in some cases disagreements. But we tried to write the categories to be fairly comprehensive. So I think pharmacy care is pretty straightforward, and psychiatric, psychological care, if you go to a psychiatrist, if you go to a psychologist, should be covered. Therapeutic care covers speech, OT, and all these things. Arica has no limits on visitations or dollar caps, because oftentimes we would find your insurance before Arica might have covered speech therapy, but it would cover like 8 visits a year. And I know, all kids with autism are different, but my child needs more than 8 visits of speech therapy a year. And there's actually a bulletin from the Division of Insurance. This is where they're really helpful. That is right on our website, where it says, just to clarify, it's like a 1-sentence bulletin. There are no limits on the number of visits or the dollar cap for Arica. The other thing we'd run into, this is really important, is insurers might say, well, we cover speech therapy, but we cover rehabilitative speech therapy. So if you had a stroke, you can get speech therapy to learn how to speak, but if you have autism and you've never spoken, or you're not where you should be, we don't cover that. That's habilitative. Well, Arica covers habilitative therapy too. So they have to cover it.